The battle over health care. The Congressional Budget Office released its report yesterday on the Republicans' plan to repeal and replace Obamacare. The CBO estimates that the bill passed by the House would reduce the federal deficit by $119 billion by 2026, while also lowering premiums. It would leave at least 23 million more Americans uninsured than under Obamacare. Democrats pointed to that last figure as their key point of opposition, but Republicans are casting doubt over the accuracy of the report. Watch.
They deserve all the respect in the world, but they're not prophets. They're trying to answer questions that go out 10 years. They're trying to predict what state legislatures and governors are going to do, and they don't even know who those legislators and governors are going to be. And so I think it's an impossible task to some degree.
Joining us right now is the founder and CEO of StartUp Health, that is Steve Krein, with us, along with Highland Capital Management, Head of Healthcare Credit and Equity. Michael Gregory is with us. Great to see you both. Thank you so much for joining us.
Great to see you again, Maria.
Great to see you.
Thank you. Michael, you're looking at the whole spectrum of healthcare companies. Tell us your view on the CBO score and its impacts.
Well, the big takeaway is there's nothing last night that would impede the flow of this bill into the Senate, who's going to rewrite and dictate the future outcome. A couple things in here that are of note. Number one, the number of 23 million people who are going to lose health care insurance, that's inflated. 17 million people don't have insurance now. So what last night was a re-rating of the CBO's original estimates of how many people would have health insurance from 2016 to 2026. That's 12 million people who don't have Medicaid now, who they thought that would. So states like Texas and Florida, I can tell you definitively they wouldn't have expanded Medicaid irrespective of anything in the ACA. And then secondly, 5 million people who they assumed would pick up coverage on the exchanges using the 2016 baseline. They've already re-updated that number for 2017. So what we should do is focus on the 6 million people who really may lose health insurance. And there is a silver lining here that I learned last night. For individuals who are middle-aged and working, premiums may get covered by the newly introduced Republican tax credit. So this is a big win for the middle class. The Republicans need a brand management coordinator. They need a PR agent on this bill. It is clearly not as bad as advertised.
Exactly what Dagan was just saying a few minutes ago.
Get on board. How about highlighting the fact that premiums will fall 4 to 20%, depending on the market over that 10-year period. Now, I'm going to call Senator Chuck Schumer out on this because he talks about, he said, the CBO report confirms that Trump care is a cancer. So stop using that word to anybody who's ever actually battled that disease or who has a family member who is battling it or lost a family member to it.
Right.
But then he takes issue with the score that premiums will fall. So you can't have it both ways, Chuck. What is it?
But the other thing that you mentioned, which I want to get your take on, is the fact that of the choice. A lot of people, a big portion of that 23 million are not going to have insurance because they're choosing not to have insurance.
It's not mandated by the government. They won't get hit with a penalty through the IRS, and they will choose. It is millions of Americans who will choose not to buy health insurance. Choose.
Yeah.
The reality is the Republicans have inherited a mess. Premiums are out of control. The insurance companies have lost hundreds of billions of dollars. And it's not a ship that can get righted immediately. Even in this plan, we're expecting premiums to increase in 2018 by 20% in the individual market and 5% in 2019. Only until we get to 2020, when a lot of the key provisions in the bill take effect, can premiums start to actually decelerate.
Yeah, one thing that's really dishonest about this whole conversation is the fact that Obamacare is imploding and the left will not even admit that. There's no acknowledgement whatsoever. Just yesterday we got the news that Blue Cross and Blue Shield announced that it's no longer going to be offering individual Obamacare plans in parts of Kansas and Missouri due to unsustainable losses. So here we have more. Now we got United Health, Aetna, Anthem, Blue Cross Blue Shield. They're all coming out. From an innovation standpoint, let's talk about that for a second, Stephen, because you have a really innovative entrepreneurial company, StartUp Health. What's the impact?
Yeah, well, you know, it's not about Trump care or Obamacare, actually. It's actually about our mothers, fathers, sisters, and brothers. And actually, what we're seeing around the world is a wave of entrepreneurial innovation from not just entrepreneurs, but really healthcare innovators who have the mindset, who are leaning in to actually reinvent and reimagine healthcare.
Well, you have to.
You have to. And at the end of the day, we're far from seeing this anywhere close to being passed, right? So as it gets to the Senate, gets reworked, I think this is becoming a roadmap for what needs to be fixed. Obamacare is not perfect. Trump care is not going to be perfect either. I think the idea here is how do we change the dialogue to what entrepreneurs and innovators can do to actually help people, not just here in America, but all around the world, live healthier. And I think that's the big story here is we've got a global army of entrepreneurs transforming healthcare. The real story is today, that's what entrepreneurs are working on. That's what innovative organizations like SAP and Allianz and Ping An are doing when they're leaning in and putting not hundreds of millions, billions of dollars into healthcare.
That's true.
And fix it.
You know, too, and I think that's a great point is there's a lot of bad news in healthcare, clearly. And by the way, as a veteran of the Trump campaign, I will tell you, I think the single reason we won was Obamacare. I truly believe that. In October, when those premium increases were being
Kellyanne
mailed.
Conway for pushing that because she saw that coming.
When they were being mailed to people, it wasn't Russia, it wasn't emails. I believe it was Obamacare.
And it was tax reform.
But that's when we got momentum. And literally the timing couldn't have been better for Team Trump because it was in October that most people saw those massive increases. But to your point, Steve, that's the bad news is we're in a mess. And I think you're right that we did inherit a mess.
And we've been in a mess a long time.
Sure.
So healthcare is broken and has been broken.
The innovation that's going on, and by the way, almost all of it from America, thank goodness, right? The innovation that's going on out there is incredible. And our healthcare future is incredibly bright once we figure out the best way for the government to interact with
the good news is government's not going to save healthcare. Entrepreneurs and the mindset of entrepreneurship within organizations is what's going to fix healthcare. I think every day right now there are thousands of entrepreneurs working on this, big organizations working on this and leaning in, whether it's Apple, Ping An, SAP, or Allianz. This is a real topic that they're not waiting around to see what happens here.
Unfortunately, the rest of the market, putting the innovators aside, Stephen, look at these insurance companies. I mean, you know, give us the impact from your standpoint, Michael. Sorry.
So the insurance companies, if you're not involved in the Obamacare exchanges, it's not going to hurt you. So by pulling out, many have sidestepped disastrous losses. But the go-forward look for the insurance companies is favorable. Anthem Healthcare is one of our favorite names. Now, Anthem has an easy trajectory throughout 2017. They're receiving sufficient premium to cover the cost trend in cash outlays for health expenses incurred by the people who they cover. So it's a beat and raise story throughout 17. But then look at the go-forward. It's a 15 to 20% CAGR from 2016 to 2021 on earnings. Number one, a big provision in the bill that we saw last night is a reduction in tax, $665 billion. A big piece of that is taxes on the insurers. So they sidestep a low single-digit earnings headwind. Number two, Anthem benefits from restructuring its pharmacy benefit contract with Express Scripts, which is getting a lot of immediate attention in the last few months. And that'll be a 15% contributor. And then thirdly, if tax reform comes into play, that's another 20 to 30% lift to earnings. The insurance companies are domestic-facing businesses that pay full tax. So there's a very clear picture going forward for the insurers, and we like Anthem for that reason.
That's great insights. Real quick, Stephen, StartUp Health is the world's largest digital health portfolio. Last time you were here, you said you had 100 companies. Now you've got 200 companies. Yeah,
and we're adding 100 companies a year. We're bullish. I mean, it's an incredible time. In fact, it's the best time in history to be an entrepreneur or investor in healthcare.
That's incredible. Great to see you both. Thanks very much.
Good to see you.
Fantastic insights. Stephen Krein, Michael Gregory joining us.